Well, Whitney, it might seem to people that the numbers from these reports don't really match up with the daily updates we're getting here in Spokane. It certainly seems recently that we're doing well. Daily case numbers are going down, hospitalizations too. So why are these state reports showing such a poor performance for our region? Well, there are a number of factors. For one, the daily numbers we get from the health district are just for Spokane County. The state numbers are 9 counties in eastern Washington. Second, SRHD isn't reporting all the same metrics that the state is, namely positivity rate. That's the percentage of COVID tests that come back positive, and it's the one metric eastern Washington has consistently performed poorly in. Third, the state reports just aren't as up to date.
It takes some time before it gets reported to us. Either the clinician doesn't call us with the result, or it doesn't get put into the electronic lab reporting.
The state's acting health officer says they won't publish the rate unless the data analysts are confident at least 90% of tests have been properly reported.
So you can't calculate a positivity rate on partial data, otherwise it gives you an off.
As a result, right now when reports are released on Fridays, the numbers are nearly 3 weeks old. Eastern Washington's first report showed a positivity rate of 17%. The second week it stayed flat at 17%, and the third week it went up to 21%. Given that we need to get down to 10% to move to phase 2, it feels like we're nowhere close and going backwards. But it's also worth noting almost all that data is from December. It's possible what we're looking at there is a holiday spike. With the current reporting methods, we really won't know for sure until more like late February. That's not just frustrating for people reading the reports, the people compiling them don't love it either.
None of us are happy that the delay, that it takes that long for everyone to get their I's dotted and their T's crossed.
In fact, that's why they're currently considering a process where you basically just find one lab in each region and use that lab's data as a sample.
Can you use a system that is more representative of the positivity that is in real time? And that is where the team is going right now. As we're speaking, they're working on it.
In the meantime, that 10% figure seems distant, but health experts say even that is far from the end goal here.
We were very generous in setting the rate at 10%. That is a massively high rate.
Now, that health officer also says positivity rate isn't the only important thing here. Obviously, those other 3 metrics matter as well. And even beyond that, health experts want to carefully analyze trends and view all this data holistically. So even though reopening is just about checking 4 boxes, the overall public health response has a lot more factors to consider. Mark, Whitney?